Polycystic ovary syndrome, or what commonly people call PCOS, is one of the most common reasons of infertility in women in India.
In a last year's study done at AIIMS, almost 1 in 4 women of childbearing age group had polycystic ovarian disease.
And that is why today Doctors on Call looks into what hormonal factors play a role in PCOS, and more importantly, what role does insulin resistance play in this syndrome. Welcome to Doctors on Call. I am Dr. Sonia Lal Gupta.
And I am Dr. Samir Gupta. Polycystic ovarian syndrome is an endocrine disorder that affects young women beginning in adolescent age. In simple terms, the hormones are out of balance, causing a number of symptoms including irregular periods, acne, hirsutism or excessive hair on the face and body, weight gain or obesity, hair loss, and infertility or difficulty in getting pregnant. On the ultrasound, these women are usually found to have cysts in their ovaries, and as a result, they don't function properly, causing difficulty in getting pregnant.
Multiple hormones, including increased levels of insulin and androgens like testosterone, cause these symptoms. Not only that, 70% of these women also suffer from insulin resistance. Insulin is a hormone that helps process the sugar in our body. Usually diabetics have either less amount of insulin produced or the cells become resistant to the insulin. This phenomena of insulin resistance is also seen to play a role in PCOS, and that can explain the high risk of having diabetes in these women. To understand the role of insulin resistance in PCOS, we spoke to Dr. Geeti Mahajan, an endocrinologist.
Insulin is a hormone that is secreted by an organ called the pancreas in our body. The role of insulin is to help in the utilization of the glucose, to help uptake it into the cells and store it as energy to be utilized later. Now, the state of insulin resistance develops when you require higher levels of insulin to keep your glucose in control. And the reason behind is because the insulin in itself is not as effective in helping in the uptake of the glucose. So this insulin resistance is a stage which could be genetic, or it could have other environmental factors contributing to it. So PCOS is a condition which is related to insulin resistance, in which what happens is the higher levels of insulin stimulate the ovaries to increase the production of androgens, the male hormones, including testosterone, which eventually causes symptoms of hirsutism, that's increased hair growth. It interferes with the ovulatory cycles and causes irregular menstrual cycles, plus causes acne. And elevated insulin levels also lead to acanthosis, which is darkening of your skin around your back of your neck, your axilla and your groin. So the primary treatment for PCOS or insulin resistance is lifestyle modification, which includes not just diet, but along with exercise. Now coming to the pharmacological therapy, there is a drug which is not yet FDA approved, but it's called metformin. It's a drug that we use for type 2 diabetics as well, because insulin resistance is a condition which predisposes towards type 2 diabetes in the future. So this drug acts as an insulin sensitizer and reduces the production of insulin, which is something that triggered the chain reaction in the initial process. So reducing your insulin levels will reverse the whole cycle of reducing your androgen production and eventually reducing your polycystic ovarian syndrome symptoms.
Women with PCOD are not only at a higher risk of diabetes, they're also at a higher risk of hypertension, high cholesterol, depression, and even sleep apnea.
Absolutely, and that is why early treatment, regular exercise, and a healthy diet are extremely important in anyone with PCOS.
Well, we hope you learned something today, and take care of your health, and see you next week.